So the last two studies I looked at were randomized control trials. First, one giving evidence to the spinal mechanism and the other to supraspinal mechanism. This was done by Belowski et al. And the purpose of this one was to test the thermal sensation and to see the effect on the temporal summation versus the first immediate pain. So when they talk about A-gamma fiber mediated pain, they're talking about that first perception of pain. So they used a thermal stimuli. So if you apply the thermal stimuli, that first perception of pain, that's the pain that's traveling on the A-gamma fiber, as opposed to the temporal summation, which is the repetitive application of the stimuli and that long-term feeling of pain after that first perception. So if you get the jolt of pain and then the pain that persists after that initial jolt. And so this compared a stationary bike, lumbar extension, and spinal manipulative therapy. So what they found, and they tested in the cervical region and the lumbar region, but only applied the manipulation to the lumbar region. So they found that there was group interaction. There was no difference in group interactions on the A-gamma fiber. So that's that initial quick pain. They saw no changes between any of those groups, the stationary bike, lumbar extension, or the spinal manipulation. But there was a significant change for the application of the spinal manipulation for the temporal summation. Again, going back to the gait control, where if that pain is traveling on that C fiber, the application of a force that then travels on the A delta fiber will modulate the pain at the spinal level. So this just gives support to the spinal modulation and neuroplastic changes occurring at the spinal level, and specifically pain that's being transmitted on the C fiber. So the last study is immediate changes in widespread pressure pain sensitivity, neck pain and cervical range of motion after cervical or thoracic thrust manipulation in patients with bilateral chronic mechanical neck pain. This study was a randomized controlled trial comparing thoracic and cervical manipulations for chronic neck pain. They measured pain pressure threshold, self-reported neck pain, and cervical range of motion. Their interventions were same-side cervical thrust, opposite side cervical thrust, and then same side and opposite side thoracic thrust. And the thoracic thrust was anterior to posterior through the elbows for T1 to T4. So this study found that there was a significant effect of time for all test sites. And so the test sites that they measured were the tibialis anterior, the cervical spine, and the lateral epicondyle. And so they found that no matter what intervention you received, be it a same-sided or opposite-sided cervical thrust or thoracic thrust, there was a similar increase in pain pressure threshold. And that increase was around 20%, which did not meet the MCID for asymptomatic individuals, but symptomatic individuals did not have a well-established MCID, but the asymptomatic was 21%. So it's close to the asymptomatic change for MCID, but they can't conclude that they did reach that. Also, there was no significant difference between groups for perceived pain, but this change for the thoracic and cervical thrust both met the MCID compared to baseline. There was no significant change in cervical range of motion for either of these groups or any of the four groups. So this continues to provide evidence for a supraspinal modulation of pain, and most significantly because the change was consistent for both groups for pain pressure threshold at the lateral epicondyle. One limitation to this study is that they did not have a control group, so they were unable to rule out the placebo effect as being the primary or main factor. All right, so if there is a neurophysiological effect, why does it matter and how do you apply it? So there's been pretty consistent evidence to support that something going on outside of strictly a biomechanical approach. And none of the authors really suggest that there is no biomechanical approach. It's more of a comprehensive model that there's a biomechanical and a neurophysiological effect occurring. So it's important to understand that the application of this force may be more than just a biomechanical effect to increase the explanation to your patients, so that if you can continue to provide them with more information or different type of information, if they don't maybe buy into one style, they may buy into another, which would improve their expectation effect. And improving expectation effect is important for improving their outcomes, because individuals who believe they're going to get better often get better, more likely than individuals who don't. Also, it allows for different style of decision making. You can assess the patient from a pain perspective as opposed to a strictly biomechanical approach. So they may be experiencing pain in a region that doesn't coincide with what you're seeing biomechanically, and you can choose then to approach your manual interventions from that standpoint, their pain standpoint, as opposed to a biomechanical standpoint, or both in conjunction. Also can be used for a multimodal approach, and that's to facilitate exercise and movement. Specifically with that 5 to 10 minute time frame, it may be beneficial for you to adjust providing the person an exercise intervention immediately after the spinal thrust manipulation that they would not be able to perform otherwise. So if someone's having a great level of difficulty with an exercise that requires some extension in the lumbar spine, doing that exercise immediately after the manipulation or mobilization may be more beneficial because they'll be able to complete that exercise as opposed to later where they may have an increase in pain. And also just the idea of regional interdependence is that since everything is interconnected with this supraspinal mechanism and in the spinal mechanism, individuals who may be experiencing issues away from the site could benefit from high velocity thrusts or also mobilizations. And that's everything. Lots of references. If anyone wants any of these articles, I can provide them.